Hi, my name is Keith Nelson. I'm one of the obstetrics and gynecology faculty for the ECU Brody School of Medicine and Vidant Medical Center in Greenville, North Carolina. Today I'm going to demonstrate how to don sterile gloves and sterile gown without the help of an assistant. First, remember that you'll need the rest of your personal protective equipment, including head cover, shoe covers, and a mask with eye protection. The second step will be to set up your gown and gloves in a non-sterile area where you can access both of them easily. So my gown has already been taken out of the packaging, and I'll go ahead and remove the gloves in the same way. With the printing readable, the glove openings will be toward you, and I'll unfold the paper and sort of lock it into position so that I don't have to struggle to get back to my gloves once my hands are inside the sleeves of the gown. Gowns are always folded by convention with the inside of the gown facing the outside of the folded package, so it should be very easy to find the openings to each sleeve and let the gown fall open in front of you, and then place your hands into the gown but not through the fabric end of the gown cuff. At this point, you'll have the help of an assistant to close the neck and back of the gown. Thank you. So I'll begin by picking up my left glove, and I'm going to place the thumb of the glove down onto my palm with the fingers of the glove pointing toward my elbow. I'll use my still sleeved left hand to grasp just the outermost layer of the glove, and with my right hand, I'll take the outermost layer of the glove on the other side and flip it over the fabric end of the gown. Then with a combination of pulling on the glove and pulling on the sleeve of my gown, I'll bring my hand out into the glove until the sleeve of the gown rides just behind the line of my knuckles and the fabric cuff of the sleeve is completely covered by the glove. And then I'll repeat this process on the other side. So thumb down onto my palm, fingers toward my elbow. I'll hold on to the outermost part of the glove cuff through the sleeve and flip the end of the glove over the end of my sleeve and gradually work my fingers and the glove into position. So again, my glove is covering the fabric of the gown, and the sleeve of the gown is just behind the line of my knuckles. At this point, I'll ask for the help of an assistant to hold on to one of the tails of the gown and turn. And then I'll tie, and I'm ready to join the procedure. This is a demonstration video for donning a sterile gown and gloves when the sterile gown and gloves will be coming from a sterile field. It's important to remember the rest of your personal protective equipment, so head cover, shoe covers, and a mask with eye protection. For this video, this will represent a corner of the sterile field in which the gown and gloves will be placed. Using sterile technique, I'll open this package of gloves onto the table first, followed by the sterile gown. At this point, I would normally exit the room to do my sterile scrub and hand preparation. We'll assume for the sake of this demonstration that that has been completed and I'm now returning to the sterile field. First, I will pick up my gown without touching anything else on the table. If that towel is needed, I can use that to dry my hands, or if I used an alcohol-based skin prep, I can just wait until my hands and arms are dry. The sleeve openings will always be by convention folded to the outside of this bundle. I'll let the gown unfurl in front of me and place my hands into the sleeves, but not past the end of the cuff. At this point, an assistant will close the neck and back of the gown. Thank you. Keeping my hands inside the sleeves of the gown, I can then open the sterile package of gloves. With the writing in the correct orientation, the cuff of the glove will be toward me, so I'll stretch the paper open to try to lock it in this position. So with the opening of the glove facing toward me, I will pick up the left glove and place the thumb of the left glove down onto the palm of my left hand. Using a pincher grip through the sleeve of the gown, I will grab just the outermost layer of the cuff of the glove and allow the fingers to fall onto my sleeve with the fingertips pointed toward my elbow. Using the same type of grip through the sleeve of my other arm, I'll pick up the topmost part of the cuff of the glove and flip it over the end of the gown sleeve. And then with a combination of pulling on my sleeve and pulling on the glove to get it positioned correctly, I'll work my hand into the glove. When I'm finished, the cuff of the gown should ride just across the back of my knuckles, and all of the fabric of the sterile gown should be covered by my glove with plenty of margin to spare to avoid contamination with fluid. Same thing applies for the other side, so I'll pick up my right hand glove. I'll place the thumb onto the palm of my right hand and grab that outermost layer of the cuff. I'll flip the top edge of the glove cuff over the fabric end of the sleeve and then pull on the gown and pull on my glove until my hand is seated correctly. And again, the sleeve is riding where it should. All of the fabric of the glove is covered. And my last step will be to ask an assistant to help with turning the gown. Thank you. And at this point, I am ready to participate in a sterile procedure.